As promised, we're going to bring in Michael Head, who's a global health researcher based at the University of Southampton. Michael, I'm not sure how much of what you heard from Steve there talking about the situation in Nottingham, but Louise asked him about what we saw in London, particularly at Soho as well, in Soho over the weekend. What was your take, given your background and your research on some of the scenes you saw, and were there many concerns from some of that lack of social distancing that was in place in some areas over the weekend?
Good morning. Yes, I did hear the previous conversation. I think we did see that most people on the whole were adhering to social distance guidelines. And we know that keeping a distance is one of the key and main ways of not spreading the virus. At the moment in the UK, there are still 3,000 to 4,000 new cases every day. So things like adhering to social distancing is going to be very important as we go forward.
And just looking, it's very clear from what you've both been saying that this is perhaps a small minority of people who might not be adhering to social distancing rules. How much difference can, Michael, a small minority make to, for example, the impact on infection rates?
So at the moment in the UK, most new infections are in institutions like care homes or hospitals or those meat processing plants we've been hearing about over the last couple of weeks. And it's key that we don't see too much community transmission, which we don't have at the minute. If there are lots of people making contact with each other, then it does run the risk of starting up that community transmission. And if we're heading towards the winter, we particularly don't want a second wave as the health services are becoming particularly stretched.